Sorry.
Good morning, Trinity.
Good morning. Sorry I'm late. I was caught in traffic and I didn't want to be late.
Okay.
And I just hate being late. So.
All right, so you're just a little agitated right now?
Yeah, I'm a little out of breath. Yeah.
Okay. All right, so we're just gonna review your medical history real quick.
Okay.
Just go over that. So it does look like in the past you did state that you had an asthma attack about 2 years.
About 2 years ago.
Usually allergies or exercise triggers it.
And anxiety sometimes. Yeah.
Anxiety? Okay. All right, that's fine. So we're just gonna take your blood pressure here.
Okay.
If I can grab your wrist, and then if you can uncross your legs. All right. It does show your blood pressure is a little bit high, but it's probably just because you're running late.
Okay.
You know.
Mhm.
So, just recall on what we're doing today. We're gonna go ahead and get started with that root canal, how we talked about last week.
A root canal?
Yes.
Oh, I thought it was just a cleaning today.
All right. You sure you're doing okay?
Yeah, I'm doing okay.
Did you bring your inhaler, by the way?
I usually don't bring it because it's been 2 years ago, so yeah, I figured it won't happen, so I don't bring it.
Okay, just to be on the safe side, we do have one in the office, but you want to make sure you get it, okay? I'm going to go ahead and get it real quick here. We're just going to put it on the side. So I'm going to go ahead and lean you back,
Okay.
and then we're going to get started with the numbing process here, okay?
Okay, yeah, that's fine.
You feeling better?
Yeah, it'll go away soon.
It'll
Yeah.
go away? Okay. All right, we're going to get started with the topical gel first, and then we'll do the actual anesthesia, okay? All right, I'm going to have you open. All right, we're just going to let this sit for a couple minutes here. You sure you're doing okay?
Yeah, it'll go away.
All right, let me go ahead and get the anesthesia here. You know what? I'm gonna sit you up. It doesn't seem like you're doing that good. So what I'm gonna have you do is just take 2 puffs of that inhaler. Hopefully that'll help. Okay.
Okay.
There you go. You just go ahead and take 2 puffs. All right. We're gonna wait about 5 minutes to see how you do. Okay. All right. How are you doing?
It's not getting
It's
better.
not getting better?
No.
All right, I'm gonna have you do 2 more puffs here. All right. Go ahead and lean. Guys, it doesn't seem like you're getting any better. I'm gonna go ahead and call EMS, okay?
Okay.
Hey, Emily, can you call EMS? Marisa, can you get the oxygen tank? All right, I'm gonna go ahead and get our first aid kit. So I'm gonna have you use this EpiPen. It'll help with the. Go ahead and put it on. All right. Take this. We're gonna go ahead and get the oxygen going here, okay? Until the EMS comes.
We just called EMS. EMS is on the way.
All right, Trinity, I'm gonna go ahead and have you on oxygen here until EMS comes, okay?
Alex, can you tell us why you decided to call EMS?
Okay, so after Trinity was having a hard time breathing, I had her sit her up, had her tilt forward so her airway can open, she can get more oxygen in there. And then after I seen that the 2 5 sessions when she was doing the inhaler wasn't working, that's when I decided to administer the EpiPen and call EMS.
Okay. And then also, why would you set your patient upright instead of semi-supine or supine?
This is gonna help with the airway, just to get more oxygen.
Trinity, can you kind of tell us about your asthma attack and how it progressed through the appointment?
So it originally started when I came in late for my appointment, so that really triggered it. And it progressed when he told me that I needed a root canal instead of a cleaning. And it got to the severe, my anxiety went up when I saw the needle. So that really got the severe symptoms.
Okay. What advice would you give your viewers?
So as a patient, if you know you have a history of asthma attacks, it's important to remember to bring your inhaler to your dental appointments. And also, if you know that you're having like minor symptoms, don't just like brush it off until the clinician is fine.
As a provider, double check the medical history, make sure you know what triggers the asthma attack, when was the last episode, and then don't rely on the patient even though they're saying they're fine. always check for signs and symptoms.
All right, Trinity, can you
Oh my gosh, I'm so sorry. I'm late. I was in traffic. Why am I running so fast? Well, you should already be dressed up.
what advice would you?
So that was like the minor. I don't know what it meant. Not severe, but the anxiety in me just went up. And yeah, that's what triggered it. But when I saw the needle, it was like it went high. So I don't know if I said that right.